Chapter 10 is Disability Income Insurance and Disability Benefit Programs. Our key terms for this chapter, we have accidental death and dismemberment, an insurance policy provision that protects the insured if he or she suffers loss of sight, loss of limbs, or death by accident. Armed services disability, a disability occurring or aggravated while the patient is in military service. Benefit period, a period of time during which payments for Medicare inpatient hospital benefits are available. A benefit period begins on the first day an enrollee is given inpatient hospital care, nursing care, or rehab services by a qualified provider and ends when the enrollee has not been an inpatient for 60 consecutive days. In workers' comp cases, it's the maximum amount of time that benefits will be paid to the injured or ill person for the disability. For disability insurance, it's the maximum amount of time that benefits will be paid to the injured or ill person for a disability. Next, we have CSRS, Civil Service Retirement System, a program for federal employees hired before 1984. CE, Consultative Examiner, a physician who is paid a fee to examine or test a person for disability under either the Social Security Disability Insurance, SSDI, or Supplemental Security Income, SSI program. Next, cost of living adjustment, a disability insurance provision to increase monthly benefits. DDS, Disability Determination Services, a state Social Security division office that assesses a case for disability benefits. Disability income insurance, a form of health insurance that provides periodic payments to replace income when the insured is unable to work as a result of illness, injury, or disease, and not as a result of a work-related accident or condition. Double indemnity, a feature in some life and disability insurance policies that provides for twice the face amount of the policy to be paid if death results to the insured from accidental causes. Exclusions, provisions written into the insurance contract denying coverage or limiting the scope of coverage. FERS, Federal Employee Retirement System, a program for federal employees hired after 1984 or those hired before 1984 who switched from Civil Service Retirement System, CSRS, to FERS. Future purchase option, a disability insurance provision to increase monthly benefits. Guaranteed renewable, a clause in an insurance policy that means the insurance company must renew the policy as long as premium payments are made. However, the premium may be increased when it is renewed. These policies may have age limits of 60, 65, or 70 years, or may be renewable for life. A hearing is the second level of the appeal process for an individual applying for SSDI or SSI. This is a hearing before an administrative law judge who had no part in the initial or reconsideration disability determination. Long-term disability insurance, a provision to pay benefits to a covered disabled person to age 65. Next, we have non-cancelable clause, an insurance policy clause that means the insurance company cannot increase premium rates and must renew the policy until the insured reaches the age stated in the contract. Some disability income policies have non-cancelable terms. Non-VA medical care program, a program which allows veterans to apply for and be granted medical care by a private physician rather than the nearest VA outpatient clinic if the VA facility is not within reasonable distance, when the veteran is too ill to travel to the nearest location, or when the condition needs prompt attention. Partial disability, a disability from an illness or injury that prevents an insured person from performing one or more of the functions of his or her regular job. Reconsideration, the first level of the appeal process for an individual applying for SSDI or SSI. It is a complete review of the claim by a medical or psychological consultant or disability examiner team who did not take part in the original disability determination. Residual benefits, a term used in disability income insurance for disability that is not work-related. It is the payment of partial benefits when the insured is not totally disabled. Next slide, we have residual disability, a disability from an illness or injury that prevents an insured person from performing one or more of the functions of his or her regular job. And this is also referred to as partial disability. Short-term disability insurance, a provision to pay benefits to a covered disabled person as long as he or she remains disabled up to a specific period not exceeding 2 years. The SSA, Social Security Administration, administers SSDI and SSI programs for disabled persons. And SSDI is the Social Security Disability Insurance Program, a federal entitlement program for long-term disability under Title II of the Social Security Act. It provides monthly benefits to workers and those self-employed who meet certain conditions. SDI, State Disability Insurance, also referred to as Unemployment Compensation Disability, or UCD. This is insurance that covers off-the-job injury or sickness and is paid for by deductions from a person's paycheck. This program is administered by a state agency. Supplemental benefits, disability insurance provisions that allow benefits to the insured to increase the monthly indemnity or receive a percentage of the policy premiums if an individual keeps a policy in force for 5 or 10 years or does not file any claims. SSI, Supplemental Security Income, a program of income support for low-income aged, blind, and disabled persons established by Title 16 of the Social Security Act. TD is temporary disability, the recovery period after a work-related injury during which the employee is unable to work and the condition has not stabilized. A schedule of benefits payable for the temporary disability. Temporary disability insurance, insurance that covers off-the-job injury or sickness and is paid for by deductions from a person's paycheck, and also known as unemployment compensation disability, or UCD. Total disability is a term that varies in meaning from one disability insurance policy to another. For example, a liberal definition might read, the insured must be unable to perform the major duties of his or her specific occupation. UCD, unemployment compensation disability, insurance that covers off-the-job injury or sickness and is paid for by deductions from a person's paycheck. This program is administered by a state agency and is sometimes also known as SDI, State Disability Insurance, or Temporary Disability Insurance, TDI. Veterans Affairs Disability Program, a program for honorable discharged veterans who file claim for a service-connected disability. Veterans Affairs Outpatient Clinic Card, an identification card belonging to a retired member of the armed forces that is shown when receiving medical or dental services for service-related disabilities from a clinic. Voluntary disability insurance. A majority of employees of an employer voluntarily consent to be covered by an insured or self-insured disability insurance plan instead of a state plan. WP is waiting period. For disability insurance, the initial period of time when a disabled individual is not eligible to receive benefits, even though unable to work. For workers' compensation, it's the days that must elapse before workers' comp weekly benefits become payable. And it's also known as an elimination period. And then waiver of premium, a disability insurance policy provision that an employee does not have to pay any premiums while disabled. Our key abbreviations for Chapter 10, we have AIDS, Acquired Immunodeficiency Syndrome. CE is Consultative Examiner. COLA, Cost of Living Adjustment. CSRS, Civil Service Retirement System. DDS, Disability Determination Services. FERS, Federal Employees Retirement System. HIV, Human Immunodeficiency Virus. SDI is State Disability Insurance. SSA is the Social Security Administration. SSDI program, Social Security Disability Insurance. SSI, Supplemental Security Income. TD is Temporary Disability. TDI, Temporary Disability Insurance. UCD, Unemployment Compensation Disability. VA is the Veterans Affairs. And lastly, WP is a waiting period.